When the Affordable Care Act, which is known as Obamacare by most people, when it was passed, there was a promise that if you liked your coverage, you could keep it. But this hasn't proven to be true in many cases. What happened? Let's ask Greg Young, Director of Strategic Policy and Initiatives at Medical Mutual of Ohio. Thanks for joining us again, Greg.
My pleasure. Thanks for having me.
Grandfathering. It was written into the Affordable Care Act, so where'd it go?
You're right, it was written in, and the intent of grandfathering was for plans that were in existence prior to the passage of that law, March 23rd, 2010, people could maintain them. But what happened is, in June of 2010, the departments of HHS, Health and Human Services, Treasury, Labor released regulations that were meant to define the rules for grandfathering. Well, those rules were very restrictive. So if plans made any changes of any significance, they lost those grandfathered plans.
So can you give us an example or two?
Sure can. Every plan has a defined group of benefits. So let's say that one of the benefits in your plan was significantly altered or removed. Then you lost your grandfathered status. Or you worked for,
like a coverage benefit?
Absolutely. Let's say you had autism,
okay,
and that was altered or taken out of the plan. Then you lost your grandfather
status. Then you lose the whole plan.
Absolutely.
I see.
Or if you had a scenario where your employer was helping pay for the cost of the coverage, reduce their contribution by more than 5%, and then again, you lost that grandfathered plan.
I see.
What was interesting when those regulations came out, I think it was the Department of Treasury made a list of predictions, if you will, about the number of people who would lose those grandfathered plans. It was pretty significant. Significant to the point where a number of insurers just went ahead and didn't even try and maintain grandfathered plans.
So what happened to those people who were not able to keep their coverage?
Well, what happened is, especially in the individual market, they were okay until 2014 because they could purchase coverage that kind of resembled what they had and wasn't really that different. But now in 2014, as all these new mandates kicked in, they've looked at a very different, more expensive product.
So tell me about the impact on those with employer-sponsored plans.
With the employer-sponsored plan, at least in 2014, it's not as big a deal. There were a number of changes that were made. For instance, if you're in a large employer group where there's 100+ employees, there was going to be a penalty in 2014 where if your employer either dropped your coverage or didn't bring it up to the new ACA standards, they would pay a penalty. Well, that was removed by the president for 2014. So the impact has not been as large on that segment.
All right, and when folks then signed up for the new health plans through Obamacare, what did people find?
Well, what they found was the type of product they were getting, the plan they were getting was very different.
Better, worse, or?
Well, I mean, there were a number of new mandates. For example, essential health benefits. So if you're an individual purchasing a plan, it was almost like there was a standardization of the benefits that you had to have in that plan. So what that did is it drove cost up. So it meant two things. It meant that people who had coverage, they were canceled. That's why we heard about the 5 million plus cancellations. Then when they went to get coverage, it looked very different than what they had before. It was more expensive.
And I want to talk to you again, we're out of time now, but about the subsidies. Maybe we can get you back in a couple weeks.
Sounds great. Thank you very much.
Thanks, Greg. Always good information.
Thank you.
Very important but very complicated
Absolutely.
topic. Making changes in something as big as healthcare, it's bound to bring bumps. The good news is that those who had private plans before can still get coverage, and those who were unable to get coverage before can do it now. It's complicated, though. Everybody knows that. So for help, contact Medical Mutual. My thanks to Greg for joining us today.
Thank you.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com. Next, if your stocks are high, should you say goodbye?